Hi, Nicole King here to talk about a revolutionary new medical device that actually received FDA approval for emergency use during COVID-19. That was based on preliminary studies that showed that it could be effective in helping with mechanically ventilated patients and improving their outcomes. So mechanical ventilation is a life-saving intervention that actually helps many of our ICU and critically ill patients to remain alive, to be able to heal, and it is life-saving. But there are detriments to utilizing mechanical ventilation. One of the major things is muscle atrophy, that those muscles used for expiration atrophy when on mechanical ventilation because those are not actively being used. That we see when patients come off. It's difficult to wean them off, it's difficult to extubate them, and their days on mechanical ventilation are extended because of these things. So the Ventfree is a new system that is being developed and is actually had preliminary studies and is now in its full study phase. They're working on the clinical trials now. It's basically a device that attaches to their external electrodes that attach to the abdomen of the patient, and it is also connected to the ventilation system. So when the patient, when they are exhaling, the muscles are stimulated as if they're participating in that exhalation, and that helps to improve outcomes for patients. Preliminary studies show there's a decrease in days in the ICU, there's a decrease in days on ventilation, and a better chance of having a successful extubation when weaning these patients off of the ventilator. That being said, it is in trial study, so the cost is still not known, but the anticipated benefits definitely outweigh the cost, and the ability to decrease medical care costs by decreasing days in the ICU and decreasing the days on mechanical ventilation does improve healthcare costs, not only for the hospital but also the patients. It's minimally invasive, which is also a wonderful thing. It's easy to use and has real promising benefits for our patients.